Hi, my name's Jackie. I am a naturopath and I'm also the chair of Arona. Today I'm going to be talking about some common questions regarding statutory registration. So, the topics that we're going to cover are grandparenting, scope of practice, advertising, and also referrals and collaboration. So, as a little reminder, if naturopaths and Western herbal medicine practitioners were to be statutorily registered, we would fall under government guidelines which are written by the profession and administered by the government. So, what that means is that when registration occurs, a national board is created for that profession. So, in the case of naturopaths and herbalists, it would be a board comprising of naturopaths and herbalists on that board. And the board administers guidelines around the profession. So it administers minimum education standards, competency standards, codes of conduct, and all of these things help to determine who meets the criteria for registration and who doesn't. Now, when we look at grandparenting, at the beginning of any registration process, um, there is a procedure or process in place where everybody who wants to be part of that registration can become part of it. And so what happens is the profession has determined the minimum standards of education. So in the case of naturopathy, it would be a bachelor degree in health sciences in naturopathy. And everybody who already has a bachelor degree would be automatically included in that sort of capture of the profession. Now, we all know that in our wonderful profession, we have many practitioners who have an advanced diploma or a diploma. And this was from, many years ago, like 30, 40 years ago, when there was only ever an advanced diploma around. It's unexpected and unrealistic to expect those practitioners to go back and study a bachelor when they already have an advanced diploma and they have 30 or 40 years experience. They don't need to go back and upgrade their qualifications, but they still want to be registered. And so what happens is grandparenting guidelines are created. And so what that means is that anyone that doesn't meet the tier A or the bachelor degree requirements is still able to be part of the registration process. So it might be a tier B or tier C, which would be perhaps they have an advanced diploma or a diploma. They have the relevant experience, and in this example, it would be 2 years of clinical practice. Or perhaps they have a diploma and it's uncertain as to what was taught in that diploma. It might have been, 30 or 40 years ago, but they've been in practice for 5 out of the last 10 years. Then they can still be included in the registration scheme. This is a really common thing that happens with all professions who are registered. And the best example of this would be with nursing. So, with nursing, back in the 1960s, 1970s, when nurses learnt their craft, they went to a nursing college for, 2 or 3 weeks, maybe a month, and then off they went to the hospital to learn on the job. So they have a diploma in nursing. They may have an advanced diploma in nursing. They don't have a degree, but they have decades and decades of experience in the hospital system working with patients that way. So, of course, those nurses don't need to go back and do a bachelor degree. They have the wealth of knowledge that they have gained from that experience within their career. But this, as I said, it's happened with many professions, or all professions. Chinese medicine would be a good example as well, osteopathy, chiropractic. Recently, the paramedics have been registered and they would have gone through this process as well. Scope of practice. Scope of practice is probably the most common question that a Rona gets. And people often get quite concerned that under registration, they believe that the government will control what we do as practitioners. And what I'm here to say is actually, no, that's not the case. The scope of practice, generally speaking, is very broad for most professions. They don't tend to say that people can do this or that, that they can't use this technique or they can use that technique, that they can or can't use a dietary, advice or a particular nutrient or herb. What scope of practice is, it's a very broad concept, and the boundaries of scope of practice are defined by the profession. So they look at the education standards and the competency standards for that profession, and as I said, they're very broad on purpose. If you look at the Arona website, we have, in particularly our competency standards, you could look at how broad they are and how general they are, to make sure that a naturopath is learning what they should be learning. Now, the other thing with scope of practice is that we can evolve our scope of practice over time. So when you're studying your naturopathy degree, you learn a certain amount of information and then you start practicing, in private practice if that's what you choose to do. Um, However, the profession is always evolving, it's always changing, and things, develop and sort of manifest over time. So, as a good example of that is the genetic testing that a lot of naturopaths do. When I studied, gosh, how many years ago? Over 20 years ago now. Um, when I studied, genetic testing didn't exist. Shows how old I am. But it certainly didn't exist, and particularly in a way that naturopaths can use in clinical practice. So I didn't learn any of that in my undergraduate training. However, if I wanted to use this as a tool in my practice, I could do my CPD, my continuing professional development in this area. You could upskill yourself and then become competent in that area, and then use it with your patients. So it's not defined necessarily by what you learn in your undergraduate degree. It's something that evolves over time, and you can upskill yourself in your CPD, and that can become part of your scope of practice. So for me, I didn't learn genetic testing when I was studying. Many of and neither did my colleagues. However, many of my colleagues have upskilled themselves and use that really, really amazingly effectively in their practice with their patients. Similarly with massage, I didn't learn massage as an undergraduate, and so I wouldn't be massaging my patients because that's not part of my scope of practice. So it's something that is defined by the profession under the education and competency standards, but is also defined by yourself as to what extra training you've done, what areas you feel competent in or not. Certainly, it's not something that the government is going to say you can't use, this herb or that herb. You can't use iridology. You can't use bark flowers, homeopathy, anything like that. It is defined by the practitioner and how they feel competent. All the government is concerned about is whether or not we're safe or not. And so using tools of the trade that are safe and well tested is all they're concerned about. Okay, advertising. Now, advertising is an interesting one to talk about because this is something that we are already governed by as naturopaths already under our unregulated health profession. We need to abide by advertising standards. So people talk about being concerned that they're not going to be able to advertise their services anymore, and they're not going to be able to say they treat X, Y, and Z. And it's something that we already need to be aware of, but it's also something that the government's not going to stop you from advertising your services. So, with the advertising, we are underpinned by consumer law. So, we basically can't make any claims that can't be justified. So, a good example of that is that we can't say that we cure cancer or, cure diabetes or things like that. You have to be able to use justifiable evidence to underpin any advertising that you do. So, yes, we can't say we cure diabetes, but we can say that we work with people to stabilize their blood sugar levels and to improve their diet and to help them be a healthier person. So you have to be able to use that justifiable evidence for your advertising, and this goes for everyone, not just registered practitioners, but also unregulated, unregistered practitioners as well. Um, Traditional use of herbs, nutrients, diet and lifestyle recommendations is evidence. So you don't have to have a scientific study proving that XYZ herb helps. You can have your traditional use, you can have your clinical experience backing up that evidence. So you can say something like, I have 10 years experience working with people to help lower their blood sugar levels or whatever it is. Um, the good thing about the registered practitioners is that their boards have come up with guidelines around advertising and around interpreting the law with regards to advertising. So that's the advantage that the statutorily registered professions have, is that the board has actually come up with guidelines around this. So it's really clear, it's really easy. Some associations, naturopathic associations, have done this, but some haven't. So it depends on who you're with as to whether or not they have guidelines around this to help you out. Okay, and the final thing that I want to talk about today is referrals and collaboration. So, um, the advantage of being statutorily registered is that they can refer to each other with no repercussions. So, the what I mean by that when I say that is that if a doctor has a patient that has back pain, for example, the doctor might say, you know what, I think you might benefit from a chiropractic treatment or an osteopathic treatment or going to see a physio or whatever it is. So the doctor will refer you to that practitioner, and they're very confident in that referral because they know that that practitioner is also registered under the statutory registration scheme. Um, so they have an assumption that the person that they're referring you to, be it a chiropractor, osteopath, physio, whoever it is, has a minimum level of education behind them and is competent in what they do as far as their practice goes. So the doctor will happily refer you to that practitioner. And if anything goes wrong in that referral, and the patient is unhappy and complains about that referral, the doctor is actually not responsible for that because they have referred to an already registered practitioner, and so they have no liability around that because the person is, adequately trained, adequately competent in the areas of that particular profession. If a doctor refers to an unregistered practitioner, so for example, if a doctor refers to a naturopath or a herbalist, and anything goes wrong in that referral, they are actually held responsible for that referral. So, and it's because that we are unregulated and unregistered, we don't have a level of minimum education behind us that is mandated. And so the doctor cannot be sure who they're referring to is adequately trained. So if anything goes wrong with that referral, the doctor is actually held responsible for that. So you can sort of see why sometimes other practitioners aren't particularly forthcoming in referring to naturopaths and herbalists for that reason. The other thing that would help with statutory registration is our ability to work within the private sector, within government agencies. Again, because we have that minimum level of education behind us, those employers will be more confident in employing naturopaths in those areas because they know that these education standards that we have and the competency standards that we have ensure that the practitioner is a competent individual. So it would actually protect organisations looking to collaborate with naturopaths to ensure those minimum standards are upheld. So, private health insurance companies, I mean, how good would it be if we had a whole heap of naturopaths working for private health insurance companies, government agencies and other health services having naturopaths in there? Imagine if a naturopath was working in a hospital in the kitchen area or in the area that advises diet and meals for patients in a hospital. All of these things are so, I suppose, aspirational for us as a profession because if we do get registration, these types of things will start happening. Okay, thank you so much for your time, and I hope this answers some of the questions that you have.